Welcome to Notes from No More Hygiene. Dr. Nabors, good day. I hope you're not having any candy after Halloween,
No, we are.
because we are going to talk about diabetes today, which is a perfect post-Halloween topic, and we're glad to have you back. I see you shed the Joker.
Yes, right. Appropriate week, that we did that for, and also an appropriate topic for sugar, from a
Yes.
standpoint, so we haven't talked a lot about diabetes in the past several probably months of this. There's been so much information on heart disease, so much information on Alzheimer's and those correlations that diabetes has been a little bit forgotten about. I think it's one of the first correlations that we ever discussed was how controlling blood sugar was much more difficult for our diabetic patients, as well as healing of all the things that we kind of knew about diabetes. But like you were saying when we were talking before the recording, this particular study that we're going to be discussing, shows the bidirectional link, which is one can cause the other and vice versa. And
Wow,
that's
so it goes both ways. So if you have a diabetic patient, they're higher risk. Diabetes itself can cause periodontal disease, and periodontal disease can cause diabetes. It cuts both ways, double-edged sword.
Right. And we talked about, when we're talking about studies, medical studies versus maybe some of the dental studies that we were used to talking about when we were learning the dental side. And our medical colleagues, when they do a long-term study, this study was over 15 years, had almost 160,000 participants.
That's a
So
bunch.
this is long-term data. It's proving these points with more than just 100 people or 50
Right.
people, or it's well vetted in terms of where this information is coming from.
So, and my understanding is too that they estimate that there's like a third of the diabetics that have yet to be in America that haven't been diagnosed. They're walking around with it and they don't even know it.
I'll look down here and read because they're estimating, I believe, 800 million. I mean, they're talking about the prevalence too of periodontal disease in general.
Yeah.
And then how many cases of that are untreated out there right now. And when you start combining different types of inflammatory reactions in the body, they all have a compounding effect. They're not just linear. So that if you've got high blood sugar and you've got high inflammatory reactions because of periodontal disease, and you kind of stack these things on top of one another, these cumulative effect that these problems have on our sort of internal 911 system or our immune system. I mean, it's quite a burden for the body to be carrying multiple things like this. And so obviously we're going to lean back on to treating this early, so that that's one less thing that our body has to address on a daily basis.
So daily application here, again, pay very close attention to especially your new patients' health history form. Anybody who checks diabetes, man, we know now based on this study, and we have just one more piece of the evidence that it can have a direct link, can be a causal link to periodontal disease and vice versa. So thank you for the post-Halloween insight, Dr. So if you have any Halloween candy left, now's a good time to donate it to charity.
With the Joker, so we won't address that again.
And we'll provide a link to the research with this video, as well as upcoming dates and locations for No More Hygiene. Just had a great in-person No More Hygiene in Fort Worth, and more to come. All right. Thanks, Dr. Nabors.
All right. See ya.